Backup of gland, caregiver, often caused by right side. Histopathology is defined by dilated central vein and combined with depth of liver, proceed, and juice. Levels that are arranged in small or lobes. Angel fluid has a central vein in the middle and portal tract as in PVC. The flow of blood is blocked from moving out of central vein, causing it to pull backwards into the tiny blood vessel. Tiny. The stooling creates a specific microscopic patch, congestion. Central veins and surrounding the tiny side become swollen and engorged with red blood cells, atrophy and necrosis. Center of the blood, zone 3, suffers from poor oxygen, hypoxia, causes the liver cell that fail, die, bleed, fatigue. Outer edges of the lobe, zone 1, survive better because they get fresh blood, but they often develop fatty deposits. The right. Chronic venous condition. Next to chronic venous condition of the lungs. Chronic venous condition of the lungs occurs when the heart cannot pump blood out properly of from those to left side or right. Lack of blood makes lungs equal BPC heavy, far and drop. Is the vocabulary good with the congested capital. Advances of the regulators in the walls of air, sac, alveoli, come swollen and engorge red blood cells. Alveolar hemorrhage. Small capillaries are leaking red blood cells directly into the air. Heart failure. Immune cells called macrophages eat the leaked blood cells and digest them into brownish iron-rich pigment or hemocysteine. Septal fibrosis. Long-term strain forces the walls of air sac become thick and stiff, fibrous marks. Chronic venous condition. Chronic butterfly. Chronic venous. Next is chronic venous condition of the sleep. Chronic venous condition of sleep happens when the blood is trapped, not is usually caused by liver cirrhosis, which blocks blood or heart rate. Pain becomes big and far. Under a microscope, the three kinds of PVC include sinusoidal dilation, relatives in the red part, fat and straight, trapped blood. However, outer capsule and inner wall being thicker. Hydrofibrosis produce tiny gold hemorrhage, the tissues, source of iron and calcium, creating colored spot or abdominal can be caused. High pulse rate, immune twisting, right? Things to make room for extra blood. Think of the train like it's gone, and a train is long, like burning. One should stop too much water and flat. Over time, one gets stiff and fat. Chronic venous condition is fine. Clean. Chronic venous condition of the kidney. Chronic venous condition of the kidney. Circulate down congested perfect occurs when elevated people systemic venous pressure, particularly from right side of heart failure, elevated intra-abdominal pressure, impact renal venous outflow. Histologically, it is characterized by prominent vascular involvement, progressive tubular vascular limits, most common, peritubular capillary dilation. The microscopic vessels surrounding the renal tubules become heavily enlarged, dilated and packed with red blood cells. While nearly invisible in a healthy state, they become highly prominent under condition. Marked venous dilation. The larger interlobular and arcuate renal veins show severe luminal expansion. Pericyte detachment. Advanced electron microscopy often captures the detachment of pericytes from the capillaries, which disrupts localized cortical and medullary circulation. Tubulointerstitial changes. Acute tubular injury. Chronic oxygen deprivation, hypoxia, caused by stagnant blood flow, leads to focal low-grade tubular damage. This includes cellular swelling, flattening of epithelial cells, and the presence of proteinaceous gas in the tubular limits. Interstitial edema. Increased hydrostatic pressure retrogradely forces fluid to leak out of the capillaries and expand the interstitial spaces. Interstitial fibrosis and tubular atrophy. As the condition transitions to a chronic stage, persistent hypoxia triggers a pericyte to myofibroblast transition. This leads to localized extracellular matrix expansion, small areas of interstitial fibrosis, and gradual tubular atrophy. Glomerular appearance. Relative glomerular sparing. Unlike primary renal diseases, the glomeruli generally retain a normal appearance with intact basement membranes and baseline cell members. Glomerular capillary dilatation. In some cases, the retrograde pressure can manifest as a mild congestion and stretching within the glomerular loops, occasionally resulting in an elevated overall glomerular surface area, glomerulomegaly. This is another slide of chronic venous congestion of the kidney under microscope. So today we have discussed histopathology slides of chronic venous congestion of liver, spleen, lungs, and kidney. Thank you for listening.